Thank you, Soror. Hello, everyone. My name is Dr. Dion Johnson. I am a clinical and forensic psychologist, and I am also committee chair of the Mental Health Committee of Alpha Beta Gamma Omega chapter. May is Mental Health Awareness Month. According to the National Institutes of Mental Health, 1 in 5 Americans lives with a mental health condition. There are many contributing factors to a decline in your mental health, including isolation, grief, perfectionism, workplace stress, job loss, illness, and family discord. It is important to remember that you are not alone. Breaking barriers to stigma related to mental health is critical to improve access to mental health treatment. Experts stress that now is the time to focus on healing, reaching out, and connecting in safe ways by acknowledging that it is okay to not be okay. Getting a good night's rest, healthy eating, engaging in physical and mindfulness activities, and spending time with family and friends are important to maintain mental wellness. Alpha Kappa Alpha Sorority Incorporated, Alpha Beta Gamma Omega chapter is committed to engaging and supporting our sisters and the community in maintaining optimal mental wellness. Here are some resources.
Thank you so much, Sora. I appreciate you. Good afternoon and welcome. I am always very excited to be here with each and every one of you, especially on a Wellness Wednesday. My name's Destiny, and I am the owner of Heal You, a therapeutic private practice, and I'm also a very proud member of Alpha Kappa Alpha Sorority Incorporated, Alpha Beta Gamma Omega chapter. Now, today, you all have received some very invaluable resources to take along with you, and I just want to add one more to your wellness toolkit. So let's go ahead and get into a comfortable position. Whatever that means for you, you can stand, you can be seated, whatever works for you. The primary goal is to make sure that your head is over your heart is over your belly, and your belly is over your pelvic bone. We just want to create enough space in our bodies to breathe. So go ahead and get into that position. Take a few seconds to get there. Relax your shoulders, shake them out a little bit. And what we are going to do today is a very simple exercise that you can do anywhere and everywhere. It just helps bring the calmness into your body. It helps relax your mind. And this is something, again, that you can do anywhere, everywhere, at any time. So if you'd like to go ahead and close your eyes or fall into a soft gaze, whatever works for you, that's completely okay. The first thing that we are going to do is we're going to practice the pranayama. So we are going to inhale through our noses and exhale through our mouths, creating almost like an ocean effect coming out of our mouths. So inhale through your nose and exhale ocean breath out your mouth. We're going to focus on 3 of these. So on your pace, your count, whatever works for you, and we'll inhale and exhale your pace, your count. And let's go ahead and do 2 more. And exhale. And 1 more. And exhale. Okay, good job. And I'll just give everyone a moment to finish up. Okay, perfect. So what I'd like to just leave you all with is just an affirmation that you can carry with you. You are calm, you are loved, and you are worthy of wellness. And you can flip this into an I statement to turn it into an I affirmation. I am calm, I am loved, and I am absolutely worthy of wellness. Thank you so much for spending time with us on this beautiful day. I'd like to pass it back over to my sorority sister. Thank you.
Good afternoon, everyone. My name is Rosemary Anderson, and I'm a licensed therapist for over 25 years and the owner of Rosemary Anderson and Associates, a group practice and consulting firm right here in Maryland. I'm a proud member of Alpha Kappa Alpha Sorority Incorporated and a charter member of Alpha Beta Gamma Omega chapter, serving Eastern Baltimore County, Maryland. I am very excited to be with you today and talk about mental health, specifically the stigma of mental health and how to reframe our conversations about mental health. And finally, I will share a few tips to support you in your mental health wellness journey. Let's take a moment first to talk about the stigma of mental health. Our skepticism about mental health began a long time ago with events like the Tuskegee experiment and the abuse of those with mental health disorders in our country's psychiatric institutions. These negative stereotypes and attitudes towards those with mental illness carry shame towards seeking help for a mental illness and feelings of failure and self doubt. Our focus should be on mental wellness, changing our language in order to reframe our minds. This is a strength based approach to healing ourselves and finding peace. Daily stress and persistent trauma may result in physiological changes in our bodies and or psychiatric illness in our mind. The body keeps the score. Trauma reshapes the body and the brain and affects pleasure, engagement, self-control, and trust. We are learning now ways to reduce our trauma response and manage our triggers. So here's some ways we can engage in daily mental health wellness. I would say start small, create measurable goals, and write those goals down. This will help you stay engaged in order to create routines and lifestyle changes. Remember to get sleep, eat right, get active, and that could mean yoga or stretching. Embrace your alone time, journal, consider the creative arts, music, drawing, painting. Start a hobby or engage in social activities. Make new friends, try meetups, join a sporting team, and attend community events. When stressful situations do arise in life, through work, home, family, and friends, we may need to seek professional mental health therapy. It's confidential and it is supportive. We sometimes don't even realize that our employers offer free counseling through their employee assistance program benefit. These sessions are short term and address life stressors that impact us in our day to day life. If you have a current mental health diagnosis or a family member with a mental health diagnosis, feel extremely burnt out, hopeless, overwhelmed with life, you should seek support as soon as possible. Meeting with your primary care physician is the first step. They can provide brief screening tools, assess your mental status, provide interventions and recommendations for other resources or referrals that are specific to your needs and that can best assist you on your mental health journey. I'll conclude by saying that there is no shame in asking for help, and perfectionism does not exist. There is peace through connection and vulnerability. We all must be willing to support one another as we engage in the therapeutic process. It has been a pleasure to speak with you today, and I wish you peace as we all navigate life's journey each and every day.
Good afternoon. My name is Ramey Ross Harvell, and I'm a licensed clinical professional counselor and board approved supervisor with the state of Maryland. Today, I'm going to be briefly discussing some mental health resources that you can access should you experience any mental health crises, whether that's for you or someone you know. Bookmark this page. First, we're going to start with 988, which is the Lifeline chat and text service. It's connected with the National Suicide Prevention Hotline. Whether you text or call this number, or you call 1-800-273-8255. Both will get you access to live counselors that will help support you through crises, whether you're experiencing suicidality or just a moment where you need some support. Both of those numbers will help access nationwide any support that you may need. Locally, there's 211, which is the Maryland support line. That is, if you dial that number and press 1, it will provide you information on how to get connected to services for individuals and families, for individuals who may be experiencing mental illness and or substance abuse issues. Contacting that number will not get you directly to someone, but it will provide you information on the services that may be available to you. You can also text the word HOME, that's HOME, to 741-741. That is a crisis text line that will get you connected to live counselors 24 hours a day to help support you through any mental health crises that you may experience. The Black Mental Health Alliance is another service that you can access that will provide counselors of African American descent who have a unique experience and can that can also uniquely speak to the needs of African Americans. There's also mentalhealth.gov, Psychology Today, the National Institute of Mental Health, and the National Alliance of Mental Illness. Those are also some great websites to contact should you need to find a provider. Black Girl Health Foundation is also another one that caters specifically towards the needs of African American women. So again, bookmark these resources so you have access to any of these supportive services if and when you need them. Thank you and have a wonderful day.
Hello, my name is Alea Thomas, and I am a charter member of Alpha Beta Gamma Omega chapter of Alpha Kappa Alpha sorority serving Eastern Baltimore County. I am a special educator by trade, and I'm also a secondary school assistant principal in the county. Today, I want to talk to you about how to obtain a therapist for your child, and also a crisis mobile team, the referral process for social work services, and IEP or individualized education plan, how to obtain services. So let's talk about the first one, therapy. If you already have an outside provider or a therapist, and you would like for that therapist to contact your child's school to discuss services or supports or strategies that are working outside of the home, and then you want to bring them into the school, which I call wraparound services, you would have to provide a consent form, which releases all the information to the school. The school cannot speak to your therapist without this consent form being signed by you. The other part is if you need a therapist, there are some schools who have therapists within their school building, for example, from the agency entitled Hope Health. At Hope Health, therapists come to the school for a certain amount of days and hours per week. If that is the route that you would like to take, you contact your school counselor. From there, they will obtain a copy of your insurance card. Once you have all that, services will begin. Now, with this method, a consent form is not needed because everything is transpired already within the school. And again, the wraparound services are also provided because now we're doing school-based services and strategies that we want you to all to take at home. That way, it's a wraparound as well. Another way is to have a referral to social work services by the social worker. How that works is you talk with your school counselor about how do you obtain services from the social worker, and that person is also involved in that conversation. From there, you all get a good idea of what social work services look like and if that's beneficial to you and your child or even your children. Another way is through the IEP or individualized education plan process. For this one, you got to dig a little bit deeper because you will need to have data. Data to prove why is this service needed for your child to be successful academically as well as socially. So what we will have to do is have a meeting and bring data to the table of how your child is performing during structured and non-structured times, as well as how they're performing at home. What do you see that's different or that's out of the ordinary that you want to have a meeting about, discuss what other strategies are in place to help your child be successful? And the last one we have is what's called a crisis mobile team. The crisis mobile team are a team of professionals who come out to the school to provide support for your child if the social worker is unavailable or off campus, or the school resource officer or SRO is also unavailable. What they do is they come out to the school, they talk with the principal, the assistant principal, every adult that's involved about what has transpired to get your child to become calm and relax and to find out what was the trigger. How did this happen and why? And how can we provide support to your child to get back to themselves or to maintain themselves and to take a breath, if you will. Once this happens, you are always contacted every step of the way. There are some instances where what is in the school, we need more support. And that's where we might take a child to Franklin Square Hospital. That way, what we don't have for them, this hospital does. And it's not a scary process at all because every step of the way, the school will be with you. I want to thank you all so much for allowing me this time to talk to you about how to obtain a therapist in school, how to bring a therapist into the building with their services, how to go through the referral process for a social worker, how the crisis mobile team works, and of course, how to get social work services on your child's IEP or individualized education plan. If you have any questions, just let me know. And again, I thank you for your time. Take care.